This session will focus on the Level 2 Healthcare Support Worker. My name is Kate Wills and I'm an independent endpoint assessor and lead IQA for healthcare standards, including the Level 2 Healthcare Support Worker. In this session, we're going to cover the following aims. We're going to explore the endpoint assessment process, have a look and fully understand what gateway means, understand ACE 360 and its use within the endpoint assessment process, have a look at how to best prepare apprentices whilst on programme, and look at how the EPA assessment is different to on programme. We're then going to look at how to use the evidence requirements, how grading occurs, and results and certification. So the starting point is to acknowledge the assessment flowchart for the overarching standard for the Level 2 Healthcare Support Worker. So if we think about the very initial stages, the starting point is registration and the point when the apprentice registers for the programme with their employment. And then there's essentially 6 stages that the apprentice will pass through to the point at which they are certificated, where they have demonstrated that they have met all of the requirements to achieve the standard. So once they've registered, they'll move into the on-programme phase, where they will focus on developing the level of occupational knowledge, skills and behaviours that are required to achieve the standard. They'll achieve the care certificate as part of their apprenticeship induction, and they'll meet the stated English and maths requirements. Alongside this, they will produce an evidence portfolio which will be utilised to support the interview. Once this is completed, they'll move on to the gateway phase, which is essentially where the employer decides the apprentice is ready prior to moving on to endpoint assessment. And this then takes the apprentice to the point at which that they will be certificated to demonstrate that they've achieved the standard. So the endpoint assessment, or EPA process, is the final assessment for an apprentice to ensure that they can do the job that they have been training for. EPA is separate to any of the qualifications or any other assessment that the apprentice may undertake during the on-programme stage of the apprenticeship. And as I said previously, the apprentice will go through a gateway process where the employer signs off to say that they are absolutely ready to move on to the endpoint assessment. The assessment will be graded, and the independent assessment organisation and the assessor must be independent of and separate from the training provided by the provider and the employer. So gateway sign-off is really important. And before we begin the endpoint assessment booking and process, the apprentices need to have got to the point where they are ready to be signed off through the gateway. So essentially, the gateway sign-off confirms that apprentices have the level of occupational knowledge, skills and behaviours required to achieve the apprenticeship, and that they're therefore ready for endpoint assessment. So the training provider can contribute to the gateway review process, but it's the employer and the apprentice that will sign the gateway declaration form. So once this has been signed, this will be uploaded onto ACE 360 as well as the required evidence. And the endpoint assessment delivery team will check and sign off at the evidence before officially scheduling the endpoint assessment. So the endpoint assessment is triggered by the employer when the gateway requirements have been met, and basically they're determining the readiness of the apprentice for the endpoint assessment. So by this point, the delivery of all training, development and review activities are considered as being on programme. Beyond that, it enters into EPA. So the independent assessor must not have been involved in any on-programme training, development or assessment of the apprentice. The assessment is agreed with the apprentice and the employer, and this takes place in the apprentice's normal place of work. So the assessment takes the format that I'm going to describe in the rest of the slides, although the sequencing of the endpoint assessment can be determined by the employer to meet the demands of that specific area. But what's really important is that the endpoint assessment fits in with how the working arrangements are for that clinical area or that health and social care setting. So there are three distinct evidence requirements for the level 2 healthcare supporter role. There's the multiple choice test, or MCT, where the apprentice will sit an exam of 60 questions over the period of 60 minutes. The observation element, where the independent assessor will observe the apprentice in the course of their normal work for 90 minutes. Now, they can allow 10% either way of this in terms of the practice that the apprentice is undertaking. Then there's the interview, and the interview is carried out in a quiet room. For the level 2, this will take between 30 and 60 minutes, and the apprentice is expected to make reference to work-based examples using their portfolio. So the multiple choice test is designed to cover all of the knowledge requirements within the standard. So 60 minutes to answer 60 one-mark questions covering communication, health interventions, personal and people development, health, safety and security, equality and diversity. And the test will be graded fail, pass, merit or distinction based on the number of marks that the apprentices achieve. Moving on to the observation of practice, as I've mentioned, the independent assessor will spend a minimum of 90 minutes observing the practice. Now, this should be in the normal course of an apprentice's work. It needs to be as natural as possible. There's a whole selection there of criteria that the independent assessor will be observing the apprentice on. And essentially, during the assessment, during the observation, the apprentice must demonstrate each of these standards have been met. So there's only a pass or an ungraded for the observation element of the endpoint assessment. So if for some reason the apprentice does not demonstrate any of these areas of practice or does not undertake them safely or in line with contemporary practice, then they would not be able to achieve a pass. So it's really important that the apprentice is appropriately prepared and understands that each of these areas are going to need to be undertaken in order for them to pass the observation of practice. The interview, which is supported by the evidence portfolio, is planned and structured, and it's competency-based, and it's a true interview and discussion between the apprentice and the independent endpoint assessor. And the purpose is to assess the apprentice's level of competency linked to the relevant apprenticeship standard outcomes. So this is recorded, it's a formal process, and it gives the apprentice a real opportunity to showcase, using real work-based evidence from their portfolio, their ability to use relevant skills, behaviours and underpinning knowledge effectively to undertake their duties as a healthcare support worker. So there are 4 areas of focus within the interview: communication, health interventions, personal and people development, and health, safety and security. So the apprentice really needs to be able to demonstrate throughout all of those, through those fields of practice, their competence linked into rationale and examples from their practice. The evidence portfolio is really important, and it needs to consist samples of real work-based evidence that the apprentice can use to support that they've met the grade criteria and the related evidence. Every piece of work that goes into that portfolio must be valid, it must be authentic, it must be sufficient, and it must be compliant. It's really important, therefore, that the employer, the training provider and the apprentice understand this in order to ensure that what's been included within the portfolio is acceptable. So by valid, we mean it needs to be relevant and appropriate to the skills, behaviours and underpinning knowledge. Authentic means that it must be the work of the apprentice and not that of someone else or a group of people. Sufficient means it fully meets the standards. And compliant means that it does not breach regulations and organisational policies and procedures, including those concerning confidentiality. So it's the apprentice's job to produce the portfolio. And essentially, the evidence portfolio should be produced by apprentices in the final 3 months leading up to the endpoint assessment gateway. And it does form part of the gateway requirement. So it is really expected that this last 3 months is the point when the majority of evidence is collated. However, it's really important to note that where appropriate, apprentices may use evidence generated prior to this point. For example, the evidence related to development activities that could only be taken at a set point within their programme, or there may be instances where it may not be possible to generate specific evidence in the final 3 months, just because there's not enough opportunity to be able to do so because of the setting. The portfolio can either be hard copy or digital, and it's important that the apprentice works with the employer and or the training provider to agree what's going to be most suitable. It is recommended that the work-based evidence in the portfolio is sequenced, and this is really important because it will help the apprentice to find the relevant evidence when they come to their endpoint assessment. And alongside this, by labelling the evidence really clearly with the date and the number of the grade criteria, it can really help the apprentice to be very organised and will really bring out the best within the interview session of the endpoint assessment. So endpoint assessment is different to on programme. One of the biggest things for the apprentice is that the independent endpoint assessor will be unfamiliar. This will be someone that they won't have met before, arriving at their workplace to undertake a range of activity that is going to put them under pressure. We try, of course, to be and build a rapport with the apprentice, but for many it can be really a nerve-wracking experience. In terms of the endpoint assessment, the timings will be strict. So the exam is undertaken under exam conditions. It will be 60 minutes and then the time will be stopped and the paper will be removed. The observation of practice is 90 minutes, plus or minus that 10% leeway, and the interview is between 30 and 60. So it's really important that all parties understand that the timings will be very strict for the endpoint assessment. It's really important to note that no feedback will be given to the apprentice, the training provider, or the employer on the day. Now, for many apprentices, they tend to make this as an assumption that they've not done very well, but this is part of our clear instruction that as an independent endpoint assessor, we need to be fair and we need to be rigorous and we need to be consistent. And therefore, it would not be appropriate for us to give any feedback during the endpoint assessment stage. Another important point to note is that often during the on-programme experience, apprentices will almost annotate what they're doing when they're doing the observation of practice. This isn't necessary for the endpoint assessment. The apprentice needs to practice in a natural way as possible, whilst the independent endpoint assessor is observing them in that practice. So for some apprentices, it can be a bit of a shock to the system that all components may be undertaken simultaneously, meaning that they potentially could do all 3 elements of the assessment in one day, or if not, at least 2, the observation of practice and the interview. So it's important that the apprentice recognises that this is likely what will happen in order that they can fully prepare for that in terms of the spaces that are available to undertake, for example, the interview, but also to allow suitable breaks and suitable opportunity within the workplace for the observation of practice. It's important to note that the assessment is summative. So the endpoint assessment is the final point of assessment, hence why it's so important to make sure that the apprentice is ready and they're fully prepared, so that the grade that is given is the final grade. And it's also important to note that the multiple choice test and the interview will both be graded as pass, merit or distinction. So the apprentice needs to understand that the level of their work, the detail of the work, the score of their MCT will alter the overarching grade that they will be allocated for their endpoint assessment. So some top tips to best prepare apprentices. Right standard, right role, absolutely critical. It's really important that the apprentice has been onboarded onto the right standard. They need to be able to demonstrate their competence within that workplace. They need to be able to understand it and they need to be able to have really decent examples from practice. It's important that all parties understand the standard, so the employer, the training provider and the apprentice. And this will really, really help the apprentice to achieve to their maximum potential. E-portfolios are really worth considering. Often it can help the apprentice to really organise their work and ensure that they're fully prepared for their endpoint assessments. And practice does make perfect. So where possible, the apprentice needs opportunity to practice all 3 components of the endpoint assessment until they are confident and competent to undertake these. Collaboration is critical. A planning meeting will take place between the independent endpoint assessor, the apprentice and the employer and training provider prior to the endpoint assessment. One of the reasons this is really, really important is around logistics, so agreeing timings, but also to make sure that the day and the time booked is where suitable activity will be undertaken to enable successful observation of practice. So thinking about, for example, clinic times or times when specific activities happen within a ward, it's really important that this needs to be considered in order that the apprentice is not disadvantaged by the day or timing that the EPA is booked. And perhaps most importantly is making sure that they are ready. Now, this is done prior to gateway and signing that off, but it needs to be really critical that all parties need to agree this and that the apprentice is fully prepared and ready to undertake the endpoint assessment. If we think about evidence requirements and translating this into grading, the multiple choice cover, as I've said before, is a fail, pass, merit or distinction. And essentially, the more questions that are correct, the higher the score, the higher the classification the apprentice will get. So the more marks they get, the more answers that they answer correctly, they will grade higher within the multiple choice assessment. Within the observation of practice, this is really focused on the assessment of skills and behaviours. This is a pass or a fail. So an apprentice can fail if they fail to demonstrate elements of the standard within the observation of practice, or they could fail because elements of their practice are deemed unsafe. The interview is essentially a synoptic review and assessment of the apprentice's knowledge, skills, values and behaviours in practice across the standard. And again, this is a fail, pass, merit or distinction. So the apprentice, to achieve into the merit and distinction, needs to really focus on really clear work-based examples, clear rationales, analysis and demonstration of their independence within the workplace. So it's about talking about examples where they have undertaken specific tasks and why they've done them and linking those into the standards. So this slide here shows the overall grading and how that's worked out for the endpoint assessment. So what you can see is the pass is required by all elements in order to pass the overall endpoint assessment. So it's not that they can complete 2 components and let one fail. All 3 components must be passed in order for the endpoint assessment to be passed. But beyond this, you can see that there's a balance between the grade that they get around pass, merit and distinction for the multiple choice and the interview in terms of the overall endpoint assessment grade. So to be really clear, to achieve a distinction in the overall endpoint assessment, they would need to achieve a distinction in the multiple choice question and the interview. So results and certification. For final certification, the apprentice must have passed all components in the endpoint assessment. At the conclusion of the endpoint assessment, the independent assessor will collate the evidence and determines the final grading for the apprenticeship. And that grading decision is made solely by the independent assessor. The apprentice must attempt all components of the endpoint assessment on their first attempt. And should the apprentice fail any components, they're required to resit or retake only those components that they have previously failed. Resits and retakes are permitted after 1 month and within 12 months of the normal assessment component being attempted, but not after 12 months. And apprentices can only achieve a pass grade on resitting and retaking any assessment component, except where the apprentice has failed due to exceptional circumstances. So as an endpoint assessment organisation, we provide the EPA results within 5 working days of the endpoint assessment. And essentially the notification of result, or the NOR, which details the achievement and feedback, will be uploaded onto ACE 360. And that can then be viewed by the apprentice, the employer and the training provider. Any appeals can be placed following this process via the endpoint assessment delivery team. If you do have any questions that come up beyond today, please do not hesitate to contact me. My email address is kjdwills@hotmail.com. Thank you very much.